Thursday from now until the end of August. We will present these in tracks. Track 1 is focused on interdisciplinary presentations on COVID-19. We will present these live at 10:30 a.m. Pacific Time every Thursday. Track 2 is focused on the efforts to dismantle systematic racism in the United States. The anti-racism track will be presented live at noon Pacific Time every Thursday. Our third track is called Engaged Humanities, which will explore the human experience and ingenuity through language, literature, visual, and spoken storytelling. Track 3 will be at 1:30 p.m. Pacific Time every Thursday. Track 4 is all about sustainability and climate change, and over the course of the next 8 weeks, we will hear from multiple areas that study the effects and science of both. These will be at 3 p.m. Pacific Time on Thursdays. Lastly, Track 5 is all about entrepreneurship and innovation. Leaders in business, design, and science will present over these 8 weeks in Track 5, and it will be presented each Thursday at 4:30 p.m. Pacific Time. Our first faculty perspective of the season is asking the big question: why will buildings forever be changed after COVID-19? From the Institute for Health in the Built Environment, please welcome College of Design professor Kevin Van Den Wymelenberg. Hi, Dr. Wymelenberg. Hi, Kevin.
Nice job. You know, it never fails. Every intro. Sometimes I even mistake my own name. So thanks, Cora.
Yeah.
All right. So today we're going to jump in and talk about buildings and try to unpack the question, why will buildings forever be changed after coronavirus or COVID-19? I'm the professor of architecture and I run the Institute for Health in the Built Environment. I should say I have the pleasure of participating with an incredible, extraordinary and diverse group of scientists as well as industry representatives around health in the built environment through the Institute. There's partners with the Biology and the Built Environment Center, Energy Studies and Buildings Lab, as well as the Baker Lighting Lab and soon an acoustics research facility as well. Today we're going to unpack this question and show it through the lens of microbiomes in buildings, something that we've been working on extensively with our Biology and the Built Environment Center. So really the first question is to recognize that buildings will be forever changed, and I think we can all understand it because our lives have been rocked over the last 4 months with COVID-19 and coronavirus. We haven't occupied many of the buildings we normally occupy, and that has resulted in economic damage, even some ruin to mental health, and I would say added to the overall stress in our economy and our society right now. So now more than ever, we recognize that buildings are really essential to a healthy and vibrant community as well as economy. I just want to share a little bit about our team. In this group, you'll see a diverse range of individuals in terms of backgrounds, geographic locations, trainings, degrees. We've got students from biology, environmental studies, architecture, interior design, School of Journalism, and I'm sure chemistry as well. We've got faculty and non-tenure track faculty from a range of backgrounds that participate inside of the Institute. And then really beyond the University of Oregon, we really look at the Institute as sort of a wrapper around a really broad range of folks from multiple universities, as you can see in the top left, as well as from industry. And there's a lot of different organizations and industries there represented. Folks that maybe manufacture building products to folks that own large pieces of infrastructure like Nike and Microsoft. So really buildings matter to everybody, and some it's directly a part of their business engine, and in others it's the mechanism that allows their engine to run. So just a little bit of a history lesson, I guess, on architecture and sort of public health. Here we can see with the Industrial Revolution and the production of localized energy and abundant energy available, the ruin of cities, really, the growth as well as the ruin of the atmosphere within cities. They're just sort of pushing nature out and making it difficult for nature to find its place within our cities. And then we have the 1918 pandemic, which shifted our thinking about built environments again. In fact, a lot of the infrastructure that we've built in cities was leading up to creating healthy environments leading up to the 1918 pandemic, and then it got shook again with this airborne influenza virus. And really, we've been seeing that, the ramifications of that, for 100 years since. And so while coronavirus is new this year, I think it's quite probable that we'll be dealing with the ramifications of coronavirus for decades, if not centuries to come. And you look at these pictures, and if you were just to imagine sort of a Pantone color wash over them, I think you could say, hey, that looks like 2020. We talk about this as the 100-year pandemic, so to speak, and it's having implications about every aspect of our life. So in architecture, the response to that was thinking about ways to connect with nature again, where maybe through the Industrial Revolution, the cities had pushed nature out. Now we were trying to build architecture that brought nature back in. And so you see architecture like this, where it sprawls across the landscape. It's creating a lot of access to light and fresh air, and a lot of those things that kind of we understood intuitively. And then we actually unlearned for a while, for a few decades, leading up to 2020. We've described this as the indoor generation. This is an ad campaign by one of our collaborating organizations called Velux. They make windows and skylights that operate. And this was an ad campaign showing that we are spending more time indoors now than ever, and especially children. And then, of course, those indoor environments have become tighter and tighter in terms of trying to keep outdoor air from coming in because of energy efficiency goals, which are great goals. And then we've been making products and occupying those spaces with products which are off-gassing various chemicals and really having chronic and long-term health impacts to the human species. So how do we undo this indoor generation, and how do we connect our buildings back with nature? So I'm going to try to show that idea through the unseen within the built environment. So I'll describe our transition over the last 100 years or so as, or maybe even 500 years, as a movement from caves, proverbial caves, to spaceships, where 1,000 years ago, we literally occupied the land. And now we occupy hermetically sealed spaces, which are really intended to keep all outdoor impacts away, and treating the outdoor as a liability as opposed to an asset and something valuable to human life. And in so doing, we've shifted our exposure, our human exposure, to the environment that we live within. And from a microbial ecology perspective, we have narrowed the microbial ecology that we expose ourselves to every day. Everyone has heard of probiotic yogurts that help your gut. What about probiotic architecture and this idea that through shifting from outdoor living to hermetically sealed indoor living, we've actually started to swim in our own microbial soup, and we have a much less diverse indoor ecosystem than what we were exposed to previously. So what this video is going to show is try to unpack and make visual or make seen that unseen notion of the indoor environment and the microbial species that we co-occupy with it. So every surface in our building, and including ourselves and our guts, are made up of trillions of microbes. Our human person is actually more non-human than human by actual cell count. This is microbial life pulsing through our veins and in our guts. And it's really important to our human immune function. Every time we breathe in, we breathe out, there's an exchange of bacteria, and of course now we know virus as well, if one were to be infected with virus. So this visualization was put together before COVID-19, but it really helps to visualize what might be happening with the human environment exchange. And here at the Biology and the Built Environment Center at University of Oregon, we're really trying to understand, what does that interaction look like? As designers, what are we doing that shapes the indoor microbiome of buildings? And as we operate our infrastructure, what can we do to intentionally manipulate to create safer indoor environments? We know that we cannot create completely sterile environments. It's impossible. NASA has tried. We can run this next video. So we have to really understand, we need to figure out how to design with the microbiomes of these indoor environments. So in this video, we're going to look through the Lillis Business Complex. And what's occurring in this video is a study of multiple spaces within that business building. And we took a signature, if you will. We took glorified Q-tips and we swabbed the surfaces of hundreds of locations within the building. And we really created a microbial signature associated with those different offices. This particular graphic is showing a lot of different bacteria. And if you were to zoom in, which you'll get to see here in a moment, you'll see that there's an abundance of certain bacteria and a paucity of other bacteria. And then we looked at different building or room types, and we see that there's actually unique signatures depending on the room that you occupy. And that may have something to do with the environmental factors or the human behavior and activities that are going on. Maybe it's not surprising that the indoor microbiome of a bathroom looks different than your office. And then we took it the next step and looked at the air handlers that were associated. So the air that's brought out of those rooms goes through a system of those ductwork and air handlers. And then what we see is that those air handlers replicate or resemble the signature of the microbiome of the particular rooms. And then lastly, this plot here is showing that we can intentionally manipulate that. We can open windows or close ductwork to shape and shift the indoor microbiome. And what we're seeing here is that the outdoor night flush, passively ventilated office spaces had a very unique and different looking microbial signature than those office spaces that were supplied with air through code-compliant mechanical ventilation systems. And if you look deeper into that story, we'll also see that those rooms that were ventilated from the window directly had more abundant, diverse microbial ecosystem, and the ones that were ventilated in blue with just the air handlers had more human-associated pathogens, as in we may have been swimming in more of our own soup, and in that case, more likelihood of potential pathogens. Okay. So that all sets the stage for the research that we've done leading up to March of 2020, as we saw coronavirus come from Wuhan here through various channels or in Seattle or California, and eventually even to Oregon. And so early on in the beginning of March, we said we're in a unique position. We're a group of biologists that have been studying microbes in buildings, but we're also architects, and we operate these buildings with engineers and building operators. We might have something to share, and so really quickly we sprang into action and we wrote a guidance piece. This piece ended up, pardon the pun, going viral, and it's seen over 1,000 downloads a day since it was first published in early March. And has been subsequently republished 5 different times and updated as the pandemic has shifted and new information has become available. Really what this guidance document does is say we have some control to create safer indoor environments, and it lists a whole bunch of measures. And I just want to unpack some of those measures as we talk and really give you a glimpse into some of the research that helped give us confidence that we could write such a piece. So first, I just want to articulate the importance of this question around aerosols or the word airborne. And even right now, as of this recording, there is not agreement in the scientific community between CDC, WHO, and a whole host of over 200 aerosol scientists and medical professionals about the importance of the airborne pathway. I'll say that while it may not be the #1 pathway, therefore can't perhaps be technically called airborne, I would say aerosolized is hard to argue that it is not potentially aerosolized and therefore distributed around buildings through mechanical systems. And this image here just gives you a sense as every time we breathe, we exhale a cloud, and that cloud eventually dissipates, maybe settles on the tables, or gets drawn out of the room through our mechanical ventilation systems. This just gives you a good visualization of it. This next video tries to do that same thing. We'll see if it plays. If it gives us trouble, we'll skip past it really quickly. But in this video, what you're going to see, it's going to be too long, so we'll just skip to the next slide because there's only about a 10-second little snippet in there that I wanted to show. But what that video showed is, as I'm speaking here, it's creating particulate cloud around me that it hopefully is being exhausted out of this space. And that's why we're setting up these distance circles for safekeeping. I have my big 6-foot circle right here in front of me. The next video is showing what that looks like potentially as it was played out in a restaurant in Wuhan, China, back in February and March. So what we were showing here is some of the earliest evidence that this may be an aerosolized or potentially an airborne pathogen. So what happened in this setting, and this was determined after the fact through contact tracing, was that somebody was some individual within that space, in this visualization, the person in the top left corner, was likely infected and coughed or breathed or sneezed, and likely what happened is that event got aerosolized and caught up in the building's airstream, and not enough fresh air was provided. And what you're showing here is how that could be mitigated through introduction of more outdoor air. And so the contamination of the building and therefore of other individuals within the building is likely reduced in this scenario. So these visualizations are really powerful to help kind of articulate and explain something that is so difficult to comprehend, is how microbes float around in aerosols. And it took a lot of, I guess, guts to put that visualization out there, because it was based upon, while it was based upon a decade of microbiome science, the new research about coronavirus is just so rapidly emerging. And one of the reasons that we had confidence to put that video out was because of our collaboration with Oregon Health and Science University. They have been tremendous partners helping us understand microbes in buildings for the last several years. We've been studying pathogens in that building previous to coronavirus. And so when their opportunity presented itself, because of course infected individuals are going to be going to hospitals, we thought there's something that we can learn here. So we sampled many locations throughout that hospital. And I'm just going to give you a kind of quick look at some of that research. But most importantly, what I want to share is it's incredibly vulnerable that OHSU has been willing to study this problem, or this potential problem within buildings, because there's risk associated. We know that healthcare environments are some of the safest environments to go to because of the increased filtration and air exchange rates compared to other buildings. Yet we also know that there's a lot of people that will be going there that may be sick. So we're trying to understand what we can in these environments to then apply it to other buildings like campus buildings or dormitories or office buildings. So what we're going to show here is just a little bit about some of the preliminary data. And just to get you oriented, this is a patient room, and there was no patient in this room during the study. It was an empty, clean room. In fact, no patient had been in this room that had coronavirus previously. And there's two different types of data represented. So there's the solid black circles and the solid red circles. The black circles are places that we took this glorified Q-tip, this flocked swab, and we sampled the surface, collected some biomass, and then we studied it in the wet lab for the presence of the RNA associated with the coronavirus. And then the red circles are we put out plastic Petri dishes, just these little 6-inch settling plates, and let the dust or whatever particles fall into those plates, and then we swabbed those plates to study. And where there's a solid red fill is where you can see we had a positive presence of the RNA associated with coronavirus. So possibly a viable virus, or just the relic virus there represented by the RNA. And so we found it on the bathroom floor, and we found it on the return air grill, that spot in the ceiling where all the air gets sucked out of the room. Another room here, again, this room actually did have a coronavirus patient in it previously, but they hadn't been in there for over 10 days. And so the question is, well, why are we seeing some of this residual? And we started to ask deeper questions. Here you can see there are a few more locations, and the sink, the counter next to the sink tested positive for a surface swab, and one of those passive air settling dishes tested positive in this room. Interestingly, though, it wasn't in the return air grill of this room. And then finally, an operating room. And these are probably some of the safest places, except for clean rooms. Operating rooms and clean rooms are some of the safest and most purified and most sterile places that exist in our built infrastructure. And so we saw the residue, probably the residue, of the RNA of the virus in one of those passive air settling dishes. What was really encouraging about this is we wouldn't have expected to see very much in this room, and we didn't. And then most importantly, in that center of the room around the patient table, where you can see those red boxes, that's where the fresh air is coming into the space. We're seeing no presence of the virus there, and only in the corners of the room where maybe they don't see as good of a ventilation rate because the way the air moves through the space, that's where we're seeing maybe some relic RNA in the settled dust. So one more study there that we just published, and I just learned yesterday that this research was shared by the editor of the journal that we submitted it to. This is a preprint on medRxiv But then we submitted it to a journal for publication, and the editor of that journal forwarded it along to the WHO, which was really exciting to see. This was the first of the kind where we showed the presence of the RNA in the air handling systems within a healthcare facility. So these red and blue ductworks show how the air moves to and away from each of the spaces within a hospital. This is a very simple schematic of a 11-story hospital building. And then this is a blow-up of one of those air handlers. The big machine on the roof that you might notice is usually hidden behind some sort of screening elements on a roof or in the top floor of a building. And what you're seeing here is many locations within it. And really the long and short of it is that we found the presence of the RNA at the first level of filtration, at the final level of filtration, and most importantly, after the final level of filtration, where the air would be supplied back into the facility. Now, that is, of course, concerning because if the RNA is there, it's possible that an infectious virus was there. But it's also important to caveat this to say the presence of the RNA does not in and of itself mean that there's a viable viral particle there. And of course, we also still don't know what minimum dose of viral particles is important that would cause infection. Nobody in science knows that answer yet. But it is an important clue because as we learn more about the potential for aerosol transmission, the HVAC systems become more and more important. And the reason we decided to preprint this and put it out into the world before it had a final chance to go through all the normal peer review is because we really believe it could save lives. We think that if we can get this information in front of hospital engineers or anybody who runs critical infrastructure that are occupied now or making decisions about buildings that will be occupied in the future, that this information is so important to share because there are actions that we can implement right now to make these buildings as safe as possible. But it takes time. This is the last slide that just shows the data, and really simple. The big blue bar is the amount of virus RNA particles that we found on the first filter. The light blue is what we found on the final filter. So it was good that we saw less, but then of course we got concerned when we saw more again on the supply air dampers where that air is going to the spaces. So a lot of research needs to be done to determine if this is viable and the role of potential aerosol transmission. The good news is there's been no known major outbreaks in this particular hospital associated with it, and that partly suggests the value of mask wearing and other precautionary measures. Okay, so now that we show you a little bit about what we've been researching that's given us confidence about making these recommendations, what does all that look like for the buildings of the future? And why did I say how COVID-19 will forever shape buildings of the future? So I'm going to unpack just a little bit more on that, but I think it's important to contextualize that. We're dealing with a pandemic inside of a social justice crisis, inside of a climate crisis. And to some extent, these things all grind on one another and relate to one another. And I think while it's important to solve the acute problems associated with viral transmission indoors and the problems we're dealing with the impact to the economy of this pandemic, it's also important to recognize that that's within the context of these other major crises. And we need to look for ways to solve those problems together. Some cases, the climate crisis enhances or makes worse the viral epidemic. And the relationship there might be because there's more particulate matter in the environment, the more energy we use in our buildings. The more particulate matter in our environment, some populations, especially lower income populations, have greater exposure to that particular particulate matter through the jobs or through the places that they can afford to live, which then maybe makes them more susceptible to a virus, which then, of course, puts them in a really precarious situation if they're in the jobs that are essential to keep the economy running. And that's why this problem must be addressed in its context. And we're going to make that the topic of a large class that will be co-teaching with Professor Adele Amos in fall this quarter. So if you're interested, look out for it. Hopefully it'll be cross-listed in many, many different colleges. But for sure it'll be in law and architecture. We'll make it as open and online as possible so everyone can participate. So the next piece of that is, of course, understanding that architecture also impacts community. And community is so important for mental health. It's so important for a vibrant economy. And I think we're all feeling that stress of living in this pandemic, which means we have to figure out a way to thread the needle of the balance between lives and livelihoods. We want to do whatever we can to save lives, but we also need to balance that with occupying buildings because that impacts livelihoods. So what can we do with our architecture? Why do I say it will be forever changed? There are things that we can do certainly to mitigate the viral pandemic in buildings, and I'll unpack that next. But I want to back up just a sec and say there's things that we can do to support human well-being and human immune function in buildings that last well beyond this particular pandemic, will support other pandemics or other viral particles like influenza or norovirus that also plague our economies every year, but also just supporting human health and well-being broadly, whether that's the access to daylight so that we have a healthy circadian sleep-wake cycle, which supports a healthy metabolism and healthy immune function to help ward off other pathogens, or something really specific around this virus, like humidification indoors. Humidification can get the particulate matter to fall out of the air more quickly. So really, buildings are very dry by their nature, but humidification can get the particulates to fall out of the air more quickly. It can actually support human immune function by keeping your mucous membranes healthy. And then lastly, it can actually inactivate the virus particles, we think, more quickly, certainly for influenza and other viruses, and we think for coronavirus as well. This is a research project we're working on with a PhD student in architecture, where it's this idea of using bioremediation and the benefits of biophilia to support human mental health, as well as create localized breathing zones where you get fresh air right from your desk from a bioremediation strategy integral to your desk. And then you take that exhaust air as you breathe, or that exhaled air as you breathe out, and immediately purify it to try to mix the air, or limit the amount of mixing of air within spaces. So we have a pilot project funded, and we're working on larger funded projects around this space. And another one, this is just a graphic that sort of explains this idea of real-time monitoring within buildings. So we have this vision or this dream of building real-time pathogen detectors, almost like smoke detectors, that might actually send an alarm or perhaps enact a series of building operational improvement strategies. So I want to show this visualization, and if it's possible, this one has an audio file that you can just pipe directly, and I'll remain quiet.
This is the vision to save lives and restore livelihoods. The Institute for Health and the Built Environment and the University of Oregon unveiled a blueprint for building a healthy future. Buildings are the engine of the economy. Connected space is where creativity and innovation happens and where communities flourish. COVID has robbed us of community and decimated the economy. The key to restarting the engine of the economy is revealed by the unseen within buildings. By focusing on testing exhaust air for the virus, we can get a rapid signal of the presence of any individual with the virus. Empowered with that knowledge, we can act to support health and safety, triggering contact tracing and targeted human testing. We can implement building operational controls to avoid outbreaks. By retesting, we can build confidence in our engineering solutions to minimize transmission risk. We cannot test every person every day for coronavirus, but we can test every building every day, and soon, maybe every hour or even minute. Testing exhaust air provides an integrated signal for low-cost and frequent assessment of exposure risk. This awareness guides tactical actions. Every building has a range of engineering, design, and behavioral solutions to reduce transmission risk and support human health. Modified outside air exchange, humidification, filtration, and deep cleaning strategies, paired with spatial distancing, personal behaviors, and policy controls, create the necessary bundle of measures to enact a smart open and operation. Testing buildings for pathogens like coronavirus is the key to restart the engine of the economy and can be layered into emerging reopening plans. In the future, we can remain open by also testing for norovirus, influenza, and other novel viruses. Every university campus is developing plans for a safe reopen. At the University of Oregon, we are creating building-specific strategies driven by data of environmental viral load. Spatial viral awareness is essential to any crisis response and stabilization plan. Orchestrating the reopen must include continuous building monitoring. Only then can we focus human testing, properly integrate contact tracing, and evaluate the effectiveness of our risk mitigation strategies. To conceive the next generation workplace, we are creating personal fresh air solutions and distributed real-time viral monitoring. Together, these strategies will allow us to rebuild community and imagine a new economy. The blueprints are drawn, the foundation is set, it's time to build scale. Let's just do this.
All right, let's just do this, right? So this is a visualization. We did not sample the World Trade Center. We haven't done extensive sampling here on campus, though we're piloting ideas to try to implement this kind of a concept. It's a research project. We'll see if the funding persists and if we're able to succeed. So this is our dream and our hope. Rumor has it this might be getting aired on Good Morning America in the next few days or early next week. So if you watch, stay tuned and check us out. Really excited about that. And with just a little bit of wrap up, I just want to articulate why I think this is so valuable. This is an early example of an attack rate, if you will, within a building in South Korea. They use extensive contact tracing to determine that this was the location of various people on one of the floors that got sick from coronavirus over the period of a couple of weeks. And this is what that data in retrospect looked like. And what you'll see there is all the way back on February 22nd, there was likely someone who was symptomatic, or there was someone who was symptomatic, and they were likely shedding viral particles into that building on February 22nd, or maybe as early as February 19th or 20th. And then there was a small spike about 3 or 4 days later, and that's part of what we know about it, the incubation curve, about a week later, I guess. That's part of what we know about the incubation curve. And my thinking is if we were testing our buildings either manually like we're doing right now, or certainly with an automated solution, that we could have stopped that outbreak, at least the big one that happened in early March, if not the one that happened in late February. So that's my dream for how to help thread the needle and balance lives and livelihoods, because we need to find a way to occupy buildings and engage in our economy and our classwork and all of these things during the pandemic, and I'm proud to be part of a team helping to lead the way. Lastly, I just want to say we're really on a new frontier. I think that architects 100 years ago probably felt that way when we were dealing with the influenza, and really every discipline within our economy, it impacts in unique ways. And it's exciting that University of Oregon is taking a leadership role in partnership with Oregon Health and Science University to really make a difference. And as I say, a new frontier needs new pioneers. So let's go Ducks. Questions, I think, right?
Yes. Thank you, Dr. Van Wymelenberg. We have a time for just a couple of questions, and I actually have one that I think, as I'm listening to you talk, I think of all of our first-year students, and more than 4,000 of them across the university. And your research sounds like it could be appealing to students from several majors. I'm thinking, how would a sociology major or a biology major draw from the research that you're doing or the classes that you might be teaching and be able to apply that to their own education? Yeah,
thank you. It's a great question. That was part of the idea of launching this large interdisciplinary class with Professor Amos. It's law and architecture formally, but it's really about trying to integrate the amazing expertise from faculty, staff, as well as students across the whole university. These problems are big. This is the definition of a wicked problem, and we can't solve it by working in silos. We have to work cross disciplines. And what I think is exciting is there's a place for almost, or probably with creativity, every student and every major across campus to participate in solving this problem. There's a behavior change concept here. We need to get around the idea of wearing masks, or we need to get around the idea of certain types of activities that are happening in spaces, and that we need to think differently about every single one of those activities. So sociology and psychology are in play. There's economic impacts, and there's prioritizations for certain practices and procedures, and so there's business and law. There's design impacts, so there's engineering and chemistry and physics, and there's biological and there's certainly architectural. So I think there's even opportunities for performance arts, because we need to find new ways to make this visceral for a wide range of different stakeholders and people with different backgrounds and experiences.
Awesome. Do you think that your research can be applied and can be taken into communities? As I'm listening to you, I think of building codes and developments and the way that we think about the built environment. Do you think that what you're doing right now can be applied in case that we revisit a pandemic of this sort in our lifetimes?
Yeah. Certainly that's the dream. This idea of testing buildings is not easy to comprehend. The first reaction is, what, you can do that? And then the next question is, I'm not sure I want to know that information. What do I do with that? And that's totally reasonable and fair. But I'll say we have to press through that, because we know that this method works, and we know it can make changes to building standards and codes. It can make changes to the way we design new buildings and operate current infrastructure. And it's really an important layer to this kind of bundle of measures of social, or as I prefer to say, spatial distancing, because we need, as a human, we need social engagement.
Yes.
We need spatial distance. We need to wear masks. We need to have buildings that are kind of aware of the risks and are perhaps reactive or proactive to mitigate those risks. And then with time, we need to work through policies. Codes and standards take a long time to change, but we can start here and we can be the leaders.
So another question I have for you is, are undergraduates, do they have an opportunity to be part of your research or research that you and your colleagues are doing?
For sure. Yeah, I would like to think that this research is highly applied. And it's got meaningful engagement with the community. I think right now, that's really the whole idea of the Institute for Health and the Built Environment, is we're doing work with industry and students together. And we're finding that our students are getting immediately snatched up by those industry representatives that we're working with. So yes, we have undergrads, we have many undergrads working within our institute. And some of those matriculate on and stay here at Oregon and work with us as grad students, or come in certainly as grad students. And we have master's and PhD and postdocs and professional research staff. So every level, and a really amazing mentorship structure that I'm super excited and proud to be a part of.
It sounds like that you like working with undergraduates. Do you have a favorite class that you teach?
Oh, well, if I had to pick, because it was my first love, it's daylighting in buildings. I think that there's so much value that daylight in our indoor environments can provide, and I started to poke at that just a little bit. But I'll say, I've been at University of Oregon for 5 years, and I've only taught 2 classes twice. So apparently what I like to do is build new classes every time, and I'm super excited about the class we're going to be teaching in fall together with Professor Amos.
Yeah, so as a student who wants to sign up for that class, is it under law or is it under College of Design? And how would a student go about finding that class?
Yeah, for sure. So I bet you there is some way that we can make sure everybody knows about the class through this network.
Probably.
But yes, it's going to be listed for sure, cross-listed in law and design. And I'm hopeful that multiple disciplines within each of those organizations, and then we're working as fast as we can to get cross-listing in as many colleges as possible. That's a big lift, especially on a short timeline like this, but I think it's super important.
We did have a question come in live from one of our students, and it looks like we have enough time to answer that. The student asks, how long do you think it will be until we start seeing these architectural changes in public complexes and schools?
Well, some of them are seen and some of them are unseen, just to pick up on the theme of this presentation. It's already happening, that is for sure. We're already seeing new technologies be deployed, And we're seeing existing technologies and capabilities within buildings be reformulated. So, for example, here on campus, we've already made changes to how we're operating our air systems. The team here read my paper early, and we've had a great history, and they jumped into action and have already made a bunch of really important changes. And then, we're seeing new technologies. I was just talking with some of the news folks around a new technology that Amazon is putting forward called Distant Assistant, which is just a camera and some open source platform software that allows you to see if you're staying 6 feet apart from one another. That's already showing up in lobbies and in buildings that are occupied. And then there's some infrared scanners that are coming onto the space to look to see if someone might be infected and symptomatic with a temperature that maybe they didn't know it. So, and then as far as like my dream of the pathogen smoke detector, my hope is that there's enough economic pressure to solve that problem during this next 12-month period so that we can set up for a new normal for any resurge, new wave of a novel coronavirus or mutation or other viruses in the future.
That's amazing. Well, we're out of time today. Again, thank you so much, Kevin, for being here today. I know that the students who are watching and the family members who are watching took a lot out of what you had to say and the research that you're doing, and I think it's remarkable that the University of Oregon is doing that for our students and our community. So thank you so much. For the students watching today, you may complete your reflection on this program by logging into the community.uoregon.edu page and to complete that reflection and submit that. And for any questions that you might have or more information, please visit our website, orientation.uoregon.edu. You can also text us your questions at 541-346-1159, and we'll help connect you to Kevin if you need to so that he can answer some of your questions. But we really thank you for your time today, to you, Professor, and to all of you students watching. Thank you so much and enjoy the rest of your day.
We look forward to seeing you soon.